Hey there, do your legs ever feel heavy, swollen, or do you notice those twisted, bulging veins that just won't go away? You're not alone. Varicose veins are a common issue for seniors, affecting millions worldwide, especially women. But here's the thing, they're not just a cosmetic problem, they can cause discomfort, pain, and in some cases, lead to serious conditions like thrombosis. But don't worry, we're here to help. In this video, we're going to show you how seniors can take control of their leg health, boost circulation, and say goodbye to varicose veins naturally. It's all about understanding why these veins appear, what puts you at risk, and most importantly, how to prevent them from getting worse. You see, varicose veins are more than just visible veins. They're a sign that your circulation might not be working as it should. Poor blood flow in your legs can lead to swelling, aching, and even blood clots if ignored. But the good news, there are simple, natural steps you can take to keep your veins healthy and your legs feeling great. In this video, we'll cover everything you need: what causes varicose veins, why seniors are more prone to them, and the best natural methods to keep your veins strong. Whether you're just starting to notice those veins or you've been dealing with them for years, you'll find practical tips that work. Ready to take the first step toward better leg health? Let's get started. Veins are an essential part of your circulatory system. They are the blood vessels responsible for carrying blood from various parts of your body back to your heart. Unlike arteries that carry oxygen-rich blood away from the heart, veins transport oxygen-depleted blood back for reoxygenation. This journey back to the heart is a bit of an uphill battle, especially for the veins in your legs, which must push blood against gravity. To help with this, veins are equipped with tiny valves that open and close, ensuring blood flows in one direction, upward back to the heart. These valves are like one-way doors that prevent blood from flowing backward, but when these valves weaken or become damaged, they fail to close properly. As a result, blood starts to pool in the veins, rather than moving efficiently. This pooling causes the veins to stretch, twist, and bulge, leading to what we know as varicose veins. Varicose veins are those thick, twisted, and often bluish or purple veins that appear just beneath the surface of the skin. They are most commonly seen in the legs because of the constant pressure from standing and walking. Over time, this pressure, combined with weak valves, can cause veins to become larger and more visible. But why are seniors more prone to developing varicose veins? As we age, our veins naturally lose elasticity. The walls of the veins become weaker, and the valves inside them may not function as effectively. This means blood has a harder time moving against gravity, making pooling more likely. Hormonal changes also play a significant role, especially for women. Pregnancy, menopause, and hormone replacement therapy can all increase the risk of varicose veins by relaxing the walls of the veins. Moreover, a sedentary lifestyle is another major factor. Many seniors may spend long periods sitting or standing without enough movement, which reduces the effectiveness of the leg muscles in pushing blood upward. Without the help of active leg muscles, blood struggles to return to the heart, increasing the risk of it pooling in the veins. In short, varicose veins are not just a cosmetic issue, they are a sign that your blood circulation is not working as efficiently as it should. For seniors, understanding how these veins form and why they are more common can be the first step toward prevention and better leg health. Varicose veins often develop due to a combination of factors, many of which are beyond our immediate control. One of the most significant causes is genetics. If your parents or close family members have struggled with varicose veins, your chances of developing them are much higher. This is because you may inherit weaker vein walls or faulty valves, making your veins more susceptible to stretching, twisting, and becoming varicose over time. Aging is another unavoidable factor. As we age, our veins lose their natural elasticity, becoming thinner and more fragile. The tiny valves inside the veins, which are responsible for keeping blood flowing in one direction, can weaken. When these valves fail, blood starts to pool in the veins instead of moving smoothly back to the heart. This pooling creates pressure, causing the veins to swell and twist, which is the hallmark of varicose veins. Hormonal changes also play a critical role, especially for women. Female hormones such as estrogen and progesterone can relax the walls of veins, making them more prone to dilation. This is why women are more likely to develop varicose veins during pregnancy, while using birth control pills, or during menopause. Pregnancy is a particularly high-risk time because the body produces more blood to support the growing baby, which puts extra pressure on the veins in the legs. Excess weight is another major contributor. Being overweight or obese puts additional pressure on your leg veins, forcing them to work harder to push blood back to the heart. Over time, this constant pressure can weaken the veins and cause them to stretch. Poor dietary habits can make this problem worse. A diet lacking in fiber can lead to constipation, which increases abdominal pressure and affects blood flow in the legs. Additionally, not getting enough essential vitamins like vitamin C can weaken vein walls, making them more likely to become varicose. Finally, a sedentary lifestyle is a common cause of varicose veins. Sitting or standing for long periods without movement reduces the activity of your calf muscles, which are essential for helping blood flow back to the heart. These muscles act like a natural pump, pushing blood upward. Without regular movement, blood tends to pool in the legs, increasing pressure in the veins and making them more likely to become varicose. For seniors, who may spend more time sitting or resting, this can be a significant risk factor. Understanding these causes can help you take proactive steps to protect your vein health. While some factors like genetics and aging cannot be changed, maintaining a healthy weight, staying active, eating a balanced diet, and avoiding prolonged sitting or standing can significantly reduce your risk of developing varicose veins. Varicose veins are not just a cosmetic issue, they often have deep-rooted causes, many of which are beyond your immediate control. One of the most significant factors is genetics. If your parents or close relatives have struggled with varicose veins, your chances of developing them are naturally higher. This is because you may inherit a genetic predisposition for weaker vein walls or faulty valves, making your veins more susceptible to stretching, bulging, and becoming varicose over time. But genetics are just one piece of the puzzle. Aging is another major factor. As we age, the walls of our veins lose their natural elasticity. What was once a strong, flexible structure becomes thinner and more fragile. The tiny valves inside the veins, which are supposed to prevent blood from flowing backward, can also weaken with age. When these valves fail to close properly, blood begins to pool in the veins instead of moving smoothly back to the heart. This pooling increases pressure within the veins, causing them to swell, twist, and become varicose. Hormonal changes also play a critical role, especially for women. Female hormones, particularly estrogen and progesterone, tend to relax the walls of the veins, making them more prone to dilation. This is why women are more likely to develop varicose veins during times of hormonal fluctuation, such as pregnancy, menopause, or while using hormonal contraceptives. During pregnancy, for example, the increased blood volume to support the baby, combined with hormonal changes, can place extra pressure on the veins in the legs, leading to varicose veins. Weight is another significant factor. Carrying extra body weight increases the pressure on your leg veins, forcing them to work harder to push blood back to the heart. Over time, this constant pressure can weaken the veins and damage the valves, causing them to stretch and bulge. A poor diet can make this problem worse. Diets lacking in fiber can lead to constipation, which increases abdominal pressure and affects the veins in your legs. Similarly, a lack of essential vitamins, like vitamin C, which is important for collagen and vein strength, can weaken vein walls, making them more prone to damage. Lastly, a sedentary lifestyle is a common contributor to varicose veins. Sitting or standing for long periods without moving reduces the activity of your calf muscles. These muscles act like pumps, helping push blood upward against gravity. Without regular muscle movement, blood tends to pool in the lower legs, increasing pressure within the veins. This is why people who spend long hours at a desk, or those who stand for long periods without moving, are at a higher risk of developing varicose veins. Understanding these causes is crucial because it means you can take proactive steps to reduce your risk. By being aware of your genetic predisposition, managing your weight, staying active, and maintaining a healthy diet, you can protect your vein health and reduce the chances of developing painful unsightly varicose veins as you age. Thrombosis is a condition that can turn a seemingly harmless vein problem into a life-threatening situation. At its core, thrombosis means the formation of a blood clot, a thick gel-like mass of blood, within a blood vessel. When this clot forms in a deep vein, typically in the legs, it is known as deep vein thrombosis (DVT). DVT is particularly dangerous because the clot can partially or completely block blood flow within the vein. Even more frightening, a part of this clot can break off and travel through the bloodstream to vital organs, such as the lungs, leading to a life-threatening condition known as pulmonary embolism. But why are people with varicose veins more likely to experience thrombosis? The answer lies in poor blood circulation. Varicose veins develop when the valves within the veins weaken, causing blood to pool instead of flowing smoothly back to the heart. This pooling of blood in the veins creates a stagnant environment where blood moves slowly or not at all. When blood flow is slow, the chances of clot formation increase dramatically. Blood that is not actively circulating is more likely to thicken and form clots. In addition to this slow blood flow, varicose veins often have irregular, twisted shapes. These twisted veins create areas where blood can easily become trapped. When blood is stuck in these pockets, the risk of clotting increases. It's like a traffic jam inside your veins. Blood is not moving properly, and this congestion can lead to the formation of dangerous clots. The pressure within varicose veins is also higher than in normal veins. As blood pools and the veins stretch, the pressure inside them increases. This higher pressure further encourages clot formation because it damages the walls of the veins, making them inflamed and triggering the body's natural clotting response. Over time, this combination of slow blood flow, irregular vein structure, and increased pressure creates the perfect environment for a clot to form. Recognizing the signs of thrombosis is crucial because early detection can save your life. The most common symptom of deep vein thrombosis is sudden, unexplained pain in one leg. This pain is often described as a cramp or a feeling of heaviness that does not go away. The affected leg may also become swollen, and the skin can change color, turning red, warm to the touch, or even bluish-purple. In severe cases, the leg may become extremely tender, making it difficult to stand or walk. Sometimes the surface veins around the affected area become more visible, appearing swollen or enlarged. This is because the blocked deep vein causes blood to divert to surface veins, making them bulge. If a piece of the clot breaks off and travels to the lungs, you may experience symptoms of a pulmonary embolism, such as sudden shortness of breath, chest pain, rapid heartbeat, or even fainting. This is a medical emergency and requires immediate treatment. For seniors, especially those with varicose veins, understanding the connection between varicose veins and thrombosis is vital. While not every person with varicose veins will develop thrombosis, the risk is significantly higher. But the good news is that by improving blood circulation, staying active, and being aware of the symptoms, you can take control of your vein health and reduce the risks. One of the most effective ways to prevent varicose veins and improve circulation is to stay physically active. Regular physical activity is like a natural pump for your veins, especially in your legs. Walking is one of the simplest and best exercises you can do. It gets your leg muscles working, which helps push blood back to your heart, reducing the chance of blood pooling in your veins. Even just a short walk each day can make a difference. Stretching exercises and gentle leg strengthening moves are also excellent. Simple stretches like calf raises, ankle rotations, and light squats can strengthen the muscles around your veins, supporting better circulation. Maintaining a healthy weight is another crucial factor. Carrying extra body weight puts pressure on your leg veins, forcing them to work harder to push blood upward. Over time, this constant pressure can weaken the walls of your veins and damage the valves, leading to varicose veins. A balanced diet plays a key role here. Aim for foods that are high in fiber, such as fruits, vegetables, whole grains, and legumes. Fiber helps prevent constipation, which reduces abdominal pressure and supports better blood flow. Limiting your intake of sugary, fatty, and processed foods can also help you maintain a healthy weight, which is essential for vein health. A diet rich in specific nutrients can directly support the health of your veins. Foods high in hesperidin and diosmin, two powerful flavonoids found in citrus fruits like oranges, lemons, and grapefruits, can strengthen your vein walls and improve circulation. These compounds help reduce inflammation and increase vein tone, making them less prone to swelling. Vitamin C is another essential nutrient. Not only does it support immune health, but it also plays a critical role in collagen production, which is necessary for maintaining strong and flexible vein walls. Other foods to consider include dark leafy greens, nuts, seeds, and berries, which provide antioxidants that protect your blood vessels from damage. Compression stockings are another effective tool for improving circulation and preventing varicose veins. These are specially designed socks or stockings that gently squeeze your legs, helping your veins push blood back up to your heart. They work by applying the greatest pressure at the ankle and gradually decreasing pressure as they go up the leg. This helps prevent blood from pooling in the lower part of your legs. If you spend a lot of time sitting or standing, wearing compression stockings can be especially beneficial. They come in different levels of compression, so it's important to choose the right type for your needs. Light compression stockings can be used for general prevention, while stronger ones may be recommended by a doctor for more serious vein issues. Staying well hydrated is also a simple but effective way to keep your veins healthy. Drinking enough water helps keep your blood thin, making it easier for your veins to circulate it throughout your body. When you are dehydrated, your blood becomes thicker, which can slow down circulation and increase the risk of clot formation. Aim to drink water throughout the day, even if you don't feel thirsty. In addition to water, herbal teas like ginger tea and peppermint tea can also support circulation. Ginger is known for its anti-inflammatory properties, which help relax blood vessels and improve blood flow. Peppermint is soothing and can support digestion, which indirectly helps your circulation. Combining these natural methods can significantly reduce your risk of developing varicose veins and improve overall circulation. It's not about making huge changes overnight, but rather adopting simple, consistent habits that protect your vein health. Whether it's going for a daily walk, choosing a salad instead of a sugary snack, drinking an extra glass of water, or slipping on a pair of compression stockings before a long day, these small steps can make a big difference. With a bit of awareness and dedication, you can keep your legs feeling light, healthy, and free from varicose veins. When it comes to treating varicose veins, there are several options depending on the severity of the condition. For many people, starting with non-invasive treatments can provide significant relief. Medications and creams are among the first options doctors often recommend. Medications containing hesperidin and diosmin, two natural compounds derived from citrus fruits, are widely used to strengthen vein walls, improve circulation, and reduce inflammation. These flavonoids work by increasing vein tone, making them less likely to become swollen or twisted. They also help reduce the sensation of heaviness, itching, and discomfort that many people experience with varicose veins. Topical creams are another popular option. These creams typically contain ingredients like menthol, horse chestnut extract, or cooling agents that provide immediate relief from symptoms like pain, swelling, and itching. Although these creams do not treat the root cause of varicose veins, They can be an excellent way to manage symptoms, making daily life more comfortable. Many seniors find that applying a soothing cream at the end of the day helps reduce leg fatigue and makes it easier to rest. For those whose varicose veins cause more severe symptoms or cosmetic concerns, minimally invasive treatments may be recommended. Sclerotherapy is one of the most common procedures. During sclerotherapy, a special solution is injected directly into the affected veins. This solution causes the vein walls to stick together, effectively sealing off the vein. Over time, the treated vein is naturally absorbed by the body, and blood is rerouted through healthier veins. This procedure is quick, usually done in a doctor's office, and requires no downtime. Another highly effective minimally invasive treatment is laser therapy or radiofrequency ablation. In these procedures, a thin catheter is inserted into the affected vein. Using laser energy or radiofrequency waves, the vein is heated, causing it to collapse and seal shut. Like sclerotherapy, the body gradually absorbs the closed vein, and blood is redirected to healthier veins. Laser and radiofrequency treatments are generally painless, and because they are minimally invasive, they involve a quick recovery time. However, in cases where varicose veins are large, severely twisted, or causing significant pain, traditional surgery may be necessary. This is known as vein stripping or vein ligation. In this procedure, a vascular surgeon makes small incisions and removes the affected veins, typically focusing on larger veins, like the saphenous vein. Despite removing these veins, blood circulation in the leg is not affected because healthier veins take over the job of moving blood. Surgery is usually done on an outpatient basis, meaning patients can go home the same day, but recovery may take a bit longer compared to minimally invasive treatments. It is essential to know when to see a doctor. If you experience sudden severe pain in your leg, noticeable swelling, skin discoloration, or if a vein starts bleeding, you should seek medical help immediately. These could be signs of a serious complication, such as deep vein thrombosis, which can be life-threatening if not treated promptly. Regular checkups with a vascular specialist are also important, especially for seniors with a history of varicose veins. A specialist can monitor your condition, recommend the best treatment options, and ensure your veins remain healthy. Choosing the right treatment depends on various factors, including your overall health, the severity of your varicose veins, and your personal preferences. Some people may find relief with simple creams and lifestyle changes, while others may benefit from minimally invasive treatments or surgery. Regardless of which path you choose, the most important thing is to take action. Varicose veins may seem like a minor problem at first, but without proper care, they can lead to serious complications. By being proactive and working with your doctor, you can keep your veins healthy and enjoy better leg comfort every day. Maintaining good circulation is essential for seniors, and it starts with simple daily habits. One of the most important things you can do is avoid sitting or standing in one position for too long. When you sit for extended periods, blood flow in your legs slows down, increasing the risk of blood pooling in the veins. This can lead to swelling, discomfort, and even varicose veins. To prevent this, make it a habit to move every 30 minutes. Even light movements can help. Stand up, stretch your legs, rotate your ankles, or take a short walk around the room. If you spend a lot of time sitting, try doing simple seated exercises, such as leg lifts or gentle calf stretches. These small movements can keep your blood flowing and reduce the risk of circulation problems. Another great way to support circulation is by elevating your legs regularly. This is especially helpful if you experience swelling in your feet, ankles, or lower legs. To do this effectively, lie down and prop your legs up on a pillow or cushion, making sure they are raised above the level of your heart. Doing this for 15–20 minutes a few times a day can help reduce swelling and encourage blood to flow back toward your heart. It is a simple, relaxing practice that can make a big difference, especially after a long day on your feet. Choosing the right footwear is another crucial aspect of maintaining good circulation. Shoes that are too tight can restrict blood flow, while high heels can place excessive pressure on your leg veins. For seniors, comfortable, supportive shoes with a low, stable heel are the best choice. Look for shoes that provide good arch support and a cushioned sole. If you are going to be walking or standing for long periods, consider shoes with a breathable design to keep your feet cool and prevent swelling. Massaging your legs is another simple and effective way to promote circulation. Gentle, upward strokes from your feet to your thighs can help stimulate blood flow. Use a natural oil like olive oil or coconut oil, which not only makes the massage smoother, but also nourishes your skin. Regular leg massages can reduce muscle tension, prevent fluid buildup, and give your legs a relaxed, light feeling. If you are not comfortable doing this yourself, you can always ask a family member to help or visit a professional therapist. Finally, consider trying contrast therapy, which involves alternating between warm and cold water on your legs. Start by soaking your legs in warm water for a few minutes, which helps open up your blood vessels. Then switch to cold water for another minute to cause the vessels to constrict. This gentle expansion and contraction of your veins improves circulation and can relieve aching or tired legs. It is a simple home remedy that you can do in your shower or with a pair of buckets. By making these small changes part of your daily routine, you can protect your vein health and maintain good circulation well into your senior years. These methods are not only effective but also gentle, making them perfect for seniors who want to stay active and comfortable without relying on medication. In conclusion, taking care of your veins and maintaining good circulation is essential for seniors. Varicose veins are not just a cosmetic problem, they are a sign that your blood flow may be struggling. Poor circulation can lead to discomfort, pain, and even serious conditions like thrombosis. But the good news is that with simple lifestyle changes, you can protect your veins and keep your legs healthy. Regular exercise, a balanced diet, using compression stockings, and staying active are all powerful ways to improve circulation naturally. If you found this video helpful, please like, subscribe, turn on the notification bell, and share it with your friends and family. More seniors deserve to know how to protect their leg health and avoid the discomfort of varicose veins. Thank you for watching, and we wish you strong, healthy legs.